What was the disease that you had, or what was the diagnosis?
Actually, I don't know. Mother knows well. I was unconscious at that time.
Okay.
Actually, all of a sudden, there was some problem in his walking
Okay.
and some pain in the back, at the back, like that. We had taken to him to an allopathic hospital.
Okay.
The problem started was he was not able to walk at all.
Oh, later on that happened. Okay.
The whole body became stiff, and moreover, he was not able to talk properly because of memory problem.
Okay.
So when we had taken him to the hospital, and their diagnosis was Parkinson's. And before that, we did not know about it. So when they started medicine, and they said along with it, some type of massage is required.
Okay.
And it will take long run get properly healed.
Okay. So what was the decision?
That is why we brought him to Sri Krishna Pharmacy, where they will get a relaxed atmosphere, and moreover a homely atmosphere, and along with both the things, they will be able to get the treatment also. When we brought here, he was on the stretcher, but within 2 or 3 weeks, he was able to recognize people. So we continued here so that he will be able to walk and go from here. That is what the doctor promised, and he could get.
Actually, what is his Ayurvedic understanding of his disease or things?
Yeah, Shivdasan, as he mentioned, his basic problem was diabetes. We call it as prameha in Ayurveda. So it's a disease where the kapha, or the glucose content of the body, is going out of the body through urine, right? In a way that causes depletion, because you are not supposed to expel your glucose from the body, right? So this leads to a kind of a depletion in the body. And this later affects almost all organs. As a result of this depletion, we will say what happens is a aggravation of vata. We call it as vata kobam, which the air principle, or the air element, or the space element in the body gets excess, right? Which gets reversed.
Okay.
And it starts coming up. The vayu, the vata, starts coming up, and it affects both heart and then the brain.
Okay.
Right. So even in his history, there is a history of a cardiac attack. Previously, and then there is also some psychological disturbances. And now, at first he started with sleep disturbances, etc. Later it leads to some degenerative changes in the brain. The wind which comes up and it dries. As a physical wind, it dries something. It starts drying the tissues in the brain.
Okay.
It leads to the degeneration.
So it's like memory loss and things.
Yeah,
happens?
it leads to the function loss. Whatever. So wherever it creates problem, accordingly they will start producing symptoms. So this is what really. So we will call it's a trimarma aghata, like the kidneys or the urinary system, the cardiac system, and the nervous system. All these three systems are affected, which leads to this. So this specific condition we understand as udavartam. This upward upward spinning movement of vata. It's like a cyclone inside the body.
So what was the management?
Yeah, in his case, if the disease is upward spinning, the treatment is bringing it down. And of course, even in the Western allopathic hospital, they were trying to do it because he was presenting with a chronic constipation, right? They did enema, and what happened is he couldn't expel the enema, and it stayed inside. It was continuously acting, and he was getting chronic diarrhea, right? So that was the state when I received him, that he was having chronic diarrhea, and he was catheterized to take the urine out, and he was unoriented. He was not oriented to time and place. Right? So we tried to stabilize his bowel movement first. That was what we did. Then we tried to stabilize and give strength to his urinary bladder. So we almost treated it in the other way around. It started from the bladder, by, up. We started managing from there. Also, we had to give him something for the heart, because he was also presenting with some psychosis and some psychological disturbances.
Oh.
So he also gave something for that, and finally we also gave some treatment for his head and whole body to stabilize him. So it was a combination of both internal medication, external therapies.
You did it one by one, or like?
Yeah, we have to do it one by one, and I should state that both his wife and a home nurse who was assisting him, they were really critical, and they were really crucial supporters in the whole healing process. Because Ayurveda also speaks about 4 pillars of treatment, which is physician, medicine, the attender or bystander, and the patient. And it was a very difficult case, very difficult case. He was brought here in an ambulance, almost unconscious, and just because of the strength of all these 4 pillars of the physician, the medicine, the attenders, the bystanders, and the patient, now he is on his feet and leading a normal life. It's really a case which gave me a lot of confidence, and also taught me what Ayurveda can really do.